Hi, I'm Anna from Elva. Today I'm going to show you Elva Chat, one of the most advanced AI interfaces in the dental industry. With Elva, doctors, owners, and staff can simply ask questions in plain English. And Elva instantly pulls the right answers from their practice management system. Now, let's take a look inside Elva and see how your PMS becomes conversational. This is Elva Chat. The interface is familiar. On the left, you have your chat history, pinned conversations, and location selector. In the center, you have a simple AI chat interface where doctors, owners, and staff can ask questions in plain English. Before we start, let me quickly change the theme. Elva gives each user multiple light and dark theme options, so everyone can personalize the workspace. Now let's start chatting with Elva. First question. How many providers do we have today? And there it is. Elva instantly shows the provider roster for today, including who is scheduled and how many appointments each provider has. No need to open reports. No need to navigate the patient management software. No need to ask the front desk. Now let's ask another common question. Show me today's appointments. Elva pulls the schedule and gives us the appointment list directly inside the chat. This is the kind of information doctors and managers need every day. But normally, someone has to go into the PMS and find it manually. Now, let's ask something more analytical. For example, show Dr. Hasso's patient numbers for the last 30 days. Elva understands the question, retrieves the right information, and presents it as a clean chart. You can review the data visually and switch between chart styles to understand the trend faster. Now, let's make the question more complex. Let's compare last week's production with the week before, day by day, on a chart. In a traditional system, this kind of report usually takes multiple clicks, filters, and someone who knows exactly where to go. With Elva, you just ask the question. And here, we have it. Gross production compared with the previous period, including the total, the difference, the percentage change, and a visual chart. This is where Elva becomes much more than a chatbot. It turns clinic data into clear answers your team can actually use. Now let's move from practice-level questions to patient-level questions. To ask Elva about a specific patient, we first add that patient to the chat context. This tells Elva exactly who we are talking about, so the answers stay focused and relevant. Let's search for Sophia and add her to the conversation. Now we can ask patient-specific questions. For example, does she have any allergies? Elva brings up the patient health summary, including medical alerts, conditions, and important clinical notes that the team should review before treatment. Next, let's ask about insurance. We can simply ask Elva to show her insurance status, and Elva brings the benefit summary directly into the conversation. Carrier, plan type, annual max, deductible, cleanings, and next eligible date. Now let's ask a more complex insurance question. Is a crown covered for her on tooth number 14? This is where Elva becomes very powerful. It does not just give a yes or no answer. Elva checks the insurance details, explains the coverage, shows the deductible and annual max context, reviews frequency rules, and highlights risk before submission. It can even explain what your own claim history shows, including likely downgrades, reimbursement behavior, and what the team should tell the patient before treatment. Now let's switch to clinic knowledge. This is where Elva uses your office playbook, SOPs, policies, and internal rules. Let's ask, what is our cancellation policy? Elva answers based on the clinic's own rules and provides the source document so the team knows exactly where the answer came from. Now let's ask something more operational. Someone just walked in with a broken tooth and we are fully booked. What should I do? Elva gives the team a step-by-step triage process. How to determine urgency, where to fit the patient, what to capture before they sit down, and how to set expectations. So, Elva is not just answering questions from the PMS, it is combining practice data, patient context, insurance intelligence, and clinic knowledge into one conversational interface. Instead of digging through systems, reports, PDFs, and staff memory, your team can simply ask Elva. That was a quick look at Elva Chat. Now imagine this inside your own practice. Your schedule, your production, your patients, your reports, and your team asking questions in plain English. For selected dental practices, we're offering Elva Chat for free. Sign up today and let Elva turn your PMS into a conversation.